Hi everyone, my name is Natasha. In this video, I will be reviewing the PTSD and alcohol use disorder treatment plan for a 49-year-old Latina woman. I'll focus on two areas: the diagnostic tools used in the plan and the medication choices for both PTSD and alcohol use disorder. So the treatment plan included several assessments: the PCL-5 and the CAPS, and the audit, along with some lab work. I think these are all appropriate and useful for this patient. The PCL-5 or PTSD checklist for the DSM-5 is a short questionnaire that helps measure how severe a person's PTSD symptoms are. It's a good tool to use at the beginning of treatment and again later to see if the person is improving. The CAPS, which stands for Clinician Administered PTSD Scale, is known as the gold standard for diagnosing PTSD. It's a structured interview that helps confirm the diagnosis and gives a more complete picture of how trauma symptoms affect daily life. The audit, or alcohol use disorder identification test, screens for alcohol misuse and helps determine how severe the drinking problem is. This is especially important because alcohol use can make PTSD symptoms worse. Finally, including lab work like liver function tests and metabolic panels, it is smart because long-term alcohol use can affect the liver and other organs. Overall, these tools give a well-rounded view of the patient's symptoms, physical health, alcohol use, which makes them very appropriate for this case. So the medications for PTSD and alcohol use disorder. The medication plan recommends sertraline, paroxetine, and prazosin for PTSD, and naltrexone. I can never pronounce acamprostate, and the disulfiram for alcohol use disorder. These are good choices based on current guidelines. For PTSD, both Zoloft and Paxil are SSRIs that are FDA approved for PTSD. They work by increasing serotonin levels in the brain, which can help with anxiety, mood swings, and other intrusive memories. Paxil, or prazosin, is another good option, especially for patients who have nightmares or trouble sleeping related to trauma. For alcohol use disorder, naltrexone is often used to help reduce cravings and block the reward effect of alcohol. The acamprostate helps people who are already sober stay that way by balancing brain chemistry. And brain chemistry after withdrawal. The disulfiram causes unpleasant reactions if alcohol is consumed. So it's best for patients who are highly motivated to stay sober. These choices show an integrated approach, treating both the trauma and the substance use at the same time, which is very critical for recovery. So in my own experience, I've learned that the clear and the realistic goals make big differences. For example, short-term goals might include reducing nightmares or decreasing drinking frequency, while long-term goals focus on maintaining sobriety and processing trauma in therapy. Setting goals that can be measured, like lowering a PCL-5 score or reducing alcohol intake, helps the patient see their progress and stay motivated. Overall, I think the treatment plan is well structured, evidence-based, and culturally aware. It combines therapy, medication, and community support while also considering the patient's cultural background and family involvement. The plan's strength lies in how it addresses both PTSD and alcohol use disorder together, which often overlap in real life patients. Thank you guys for listening. Have a good day.